Welcome to the Better Together podcast, where we come together to look at ways we can more effectively minister to others. And today we have Dr. Fred Yerby with us. He has been working in medicine for over, I believe, 30 years in Alabama. He's a graduate of the University of Alabama. He also is married to Miss Debbie Yerby, who is a pharmacist. So the whole family seems to be involved in medicine in some way. So Dr. Yerby, thank you for taking the time to be with us today.
Thank you for having me.
Now, you know, the whole country is worried at the moment about this virus that has kind of swept through the country. Tell us a bit about some of the things from a doctor's perspective that we can do to protect ourselves as many people have become infected with this particular illness.
Right. Well, many things, Brother Eddie, are just common sense. Things like you would do during any kind of flu season or anytime there's any kind of respiratory illness that's circulating. Obviously, you want to be careful about hand washing. Wash your hands as frequently as you can. If you don't have access to soap and water, then hand sanitizer is very effective. Keep that on hand. Use that frequently if you're coming into contact with other people or with items that other people have frequently been in touch with. And then, of course, the social distancing that we keep hearing about. That's very important, too. If you can keep, at least 6 feet away from people. It is spread by respiratory droplets. So it's primarily through coughing and sneezing, and then those materials landing on surfaces, and then you perhaps touching those surfaces, and then touching your face or nose or those kind of things. So that's another important thing to remember. If you can avoid contact with your face, don't touch your face, don't touch your eyes, don't touch your nose, don't touch your mouth. So those are all things that we can do to help slow down the spread.
So that's good. Really, the things that you physicians have been telling us for a long time to do, wash our hands, and the social distancing's maybe an addition there, but a lot of just good, practical, I think you mentioned common sense hygiene helps us a lot. I suspect good cleaning is also a good deterrent to the virus.
That's right. In addition to the hand washing and the hand sanitizer, those sorts of things. And we do want to do just good general cleaning. Of course, we try to step that up a little bit in the medical environment and do that more often and maybe a little more strongly than you would do at home. But certainly using the Lysol spray or any kind of disinfectant spray. If you don't have access to that, then a bleach spray or the bleach wipes, if you have, and those are very effective. You can even make your own bleach sprays with about 10% bleach is all it takes to kill most of these organisms. So if you don't have access to some of the pre-made stuff, you can actually make some yourself at home if you can just get household common bleach. But yes, cleaning surfaces that are touched frequently like doorknobs, countertops, any types of handles on your drawers or those sorts of things. Just good general cleaning can be very effective as well.
And so for many of us that are in good health, younger folks and so forth, practice good hygiene, practice good cleaning. Really, we can do a lot, or we've done a lot to protect ourselves just by doing those things, I suppose.
That's right. It's mostly seems to be the older people and the people who have some kind of immunocompromise who are most susceptible. Now, anyone can be affected, and I think there's been some misconception that young people in general are not affected. They certainly can be infected and can be affected, although it's much less common than other people. But yes, as a younger, healthy person, you probably don't have a lot to worry about from the virus itself, but you do want to be careful that if you should become infected, that you don't spread it to other people who may be more vulnerable.
Mm-hmm. And all of us at all times want to reduce our vulnerability to any kind of illness. What are things we might do to reduce our susceptibility to illness and actually help ourselves be in a position to fight off a virus like this more effectively?
Right. So I think just general healthy lifestyle, like you should practice, at all times. But it may be a little more difficult during this times when we're sort of isolated and we're sort of many of us confined to our homes. We've got kids who are home with us. When kids are out of school and people are not going to work regularly, I think one of the things that can really be helpful is try to maintain some kind of routine.
Mm.
One of the most important things for health is good sleep.
Mhm.
So you want to try to maintain those good sleep patterns. You want to be in practice of going to bed at the same time, getting up at the same time, trying to get that good 7 or 8 hours of sleep at night, but not sleeping too much, not overdoing it if you don't have responsibilities during the day. But try to maintain those same patterns and try to maintain routine as much as you can. Get up at the right time, go to bed at the right time. And then, of course, you want to try to eat a healthy diet. You want to have
Mhm.
plenty of fruits and vegetables, that sort of thing, and less of the junk food and the grease, those sorts of things that we like here in the South, especially. But try to eat a healthy diet. Try to maintain a normal routine. Try to get plenty of sleep. Exercise can be important. Exercise can help your immune system, so you want to maintain a good exercise pattern. And maybe if you haven't been in the habit of doing that in the past, maybe now's a good time to start if you got some extra time on your hands.
Mhm.
So exercise, a good healthy diet, plenty of sleep, and maintaining those routines, I think, can be very helpful.
That's good. That's real helpful. So those are things that help us in general. We all need to start practicing those. But if perhaps you're not, it's important to get going with that quickly because when something comes up like this, it makes us all far more susceptible. One of the things as a medical professional, and we think about not just physicians and nurses, but even like pharmacists, all kinds of folks coming into contact with illness. Christians really need to be spending some time praying for our medical professionals, don't they? And what can we as Christians, what can we do as churches to support those that are really on the front line fighting this illness and fighting illness and various injuries and so forth every day?
Well, that's right, Brother Eddie. I certainly believe in prayer, believe in the power of prayer, and I think it can be very helpful. Obviously, we want to pray for healing. We want to
Mm,
pray for any of those who've been affected by the virus or infected, that they would have healing for our nation in general. There are many areas that are being very severely affected right now. We want to pray for them that this will be a relatively short-lived thing and they'll get the help that they need. But I think protection for those who are in the healthcare field, especially, that they will be protected from evil and from this virus if they come in contact with it. Um, Pray that they'll have the supplies that they need. That somehow there may be maybe a miraculous supply of some of these things that seem to be in such short supply. The
mm.
personal protective equipment that you may hear about frequently. There are many places that are running low on that or can't get what we think we may need. So pray for that. Pray for wisdom, certainly, during this time. I know I need wisdom every day that the
Yeah.
Lord only can give. And so we need that in this time. And pray that we'll have the compassion that we need, that we won't get so caught up in all that's going on that we forget to have the compassion and kindness and care for the people that we come in contact with from day to day. And we need to remember, that not only do people have physical needs, they have spiritual needs, and we need to continue to try to minister to those as well as best we can.
That's wonderful. And so, as part of that, many of us have older folks in our congregation, and even some folks sometimes in rehabilitation centers, sometimes in what would be called, I guess, assisted living facilities and so forth. It's hard for us to minister to them at this time. Any ideas you have on that, or any steps we might take when we're separated by so many of these individuals?
Well, I think just don't forget about them. Try to maintain contact as best you can, even if you can't have personal contact. You can call, you can send cards. Just don't forget about those folks. Let them know you're still thinking about them. And also, I'd like to say, when we're thinking about this virus and the coverage, the national media, and that sort of thing, take a break from that once in a while.
Mm,
We need to, you need to have that mental break. Don't spend all your day focusing on the news coverage and just concentrating on that all the time. Turn the TV off, turn the news off, get outside, get some fresh air, but take a break from that so you don't let that weigh too heavily on your mind. And pray for peace. That's another thing I wanted to add when we're talking about prayer.
hmm
Pray for peace that we know the Lord can give us.
Excellent. That's wonderful advice. And I think I think you hit the nail on the head there. Probably too much media consumption, and really there's just some basic things we can do those things and get focused. As you said earlier, have a routine, don't let it interfere with your sleep, and get on with serving the Lord and trying to stay as busy as we possibly can.
That's right.
Hey, thank you, Dr. Yerby. We appreciate you stopping and taking some time to be with us today. And just know we're praying for you and our other medical professionals that are out there on the front line serving us. And we appreciate what you do, and just keep up the good work, my friend.
Thank you, Brother Eddie. You too. Appreciate what you do.